Knock knock.
Hello.
Hi, my name is Ariani and I'm going to be the nurse practitioner student performing a head-to-toe assessment on you today. How are you?
Good, thank you.
Can you please state your name and date of birth?
January 3rd. Sorry, my name is Timis Braff and my birthday is January 13th, 1988.
Thank you, Timis. Can you tell me what day is today?
June 20th,
And the month? You said June. What's the year?
2020.
Okay, and do you know where we're at right now?
At the clinic.
So on the general survey of the patient appears properly dressed for the situation. She's alert and oriented to person, place, and time. And I'm gonna go ahead and wash my hands, and we're gonna go ahead and start your assessment, okay? Please tell me at any point in time if you have any tenderness or pain to any location. I'm gonna do my best to walk you through the exam, okay? So starting off with your head, I'm gonna go ahead and inspect your head and palpate for any abnormalities. It looks like her head is normocephalic, atraumatic, no masses or lesions are noted. I'm gonna look at her hair, palpating for her scalp. Her hair is soft, evenly distributed, no lice or any hair loss or alopecia noted to her hair. I'm gonna go ahead and inspect your face. So do you mind taking off your glasses?
Sure.
I'm gonna touch you. Tell me if you have any tenderness on palpation here.
No.
So no tenderness to facial bone area. So I'm gonna go ahead and assess for the sinuses, maxillary sinuses, any tenderness,
No.
and the frontal area sinuses, any tenderness.
No.
So no tenderness upon palpation of the maxillary and frontal sinuses. I'm gonna go ahead and check for your lacrimal apparatus. Any tenderness right here?
No.
Have you had any sort of drainage lately or anything like that?
No.
So no drainage noted to the lacrimal apparatus area. Moving down to looking at her face and inspecting, it looks like her facial bones are symmetric bilaterally, eyes are symmetric bilaterally, and her ears are even to the canthus of the eyes. Inspecting her skin, it looks like her skin is pink and moist. Skin turgor appears to be good, and no redness or rashes are noted throughout her skin. Moving down to check on your cranial nerve, trigeminal nerve, and facial nerve. I'm gonna have you clench your teeth for me. Okay, give me a big smile, and then wrinkle your forehead and raise your eyebrows. Puff out your cheeks and stick your tongue out for me. So it looks like her trigeminal and facial nerves are intact. Testing, I guess, for cessation of the trigeminal nerve, I'm gonna go ahead and put this on your face. You can tell me if you feel a soft, a dull, or a sharp touch. Close your eyes for me.
Dull. Dull. Sharp. Sharp.
So in this instance, it looks like Timis's trigeminal nerve is intact. Facial sensation is symmetrical on upper, lower, and lateral sides. Going down to the eyes, I'm gonna go ahead and inspect your eyes.
Okay.
Looking at the eyelids, they appear to be symmetrical, no ptosis noted. Her eyelids don't have any sort of redness or swelling. Lashes appear to be full and evenly distributed. I'm gonna look at your conjunctiva, okay? So I'm gonna pull down your right here, and her conjunctiva appears to be pink. No subconjunctival hemorrhages noted. Her sclera is white. The cornea is clear. Iris is round, flat, and brown. Now I'm gonna go ahead and look at your eyes with the light, okay? So just go ahead and looking at me, I'm gonna go ahead and shine a light. Just look at my nose. Okay. And then one more time here on this side. So it looks like her pupils are equal, round, and reactive to light. And I'm gonna go ahead and check for accommodation. Look at my finger and out, and accommodation is intact as well. I'm gonna go ahead and test for the corneal light reflex, and for that, I'm gonna go ahead and shine a light 30 centimeters away to the septum area. And it looks like the corneal light reflex is intact. It looks symmetrical on both eyes. No deviation is noted. I'm checking for the red light reflex I'm gonna have you take a look at the wall, and I'm gonna shine a line. I'm gonna move the light, just keep looking straight, okay? Looking at each eye. And then on this side as well. And the red reflex is intact. I'm gonna perform a fundoscopic eye exam, which just means I'm gonna shine a light to your eyes. So please take a look straight, going in a 50-degree angle. I can see that the optic disc is creamy yellow with sharp margins. No cupping is noted, lens is clear. On the other side, left side, the creamy, we notice a creamy yellow with sharp margins. Optic disc, no cupping, lens is clear, no signs of glaucoma or cataracts bilaterally. Moving down to the confrontation test, or sorry, cover and uncover test. I'm gonna cover one eye.
Okay.
Look forward. Looks like both eyes are midline, no strabismus is noted, no eye deviation is noted with the cover and uncover test. I'm gonna go ahead and do the test for confrontation. So I'm gonna have you move this way for me, okay? About arm's length, I'm gonna sit in front of the patient. So I'm gonna go ahead and cover just the same eye that I'm this side, the right eye for you. So tell me how many fingers you see.
2. 2.
Okay.
1.
Okay.
3.
Okay, very good. The other eye now.
2. 1. 2.
Okay. So for her confrontation test, the confrontation is clear, and I'm gonna go ahead and have you move forward. Again, I'm gonna check for your the cardinal 6 cardinal fields of gaze. Okay, so looking straight at me, I'm gonna have you follow my finger, and please don't move your head or anything like that when I try to do that. So following my finger, 1, 2, 3, 4, 5, 6. So her EOMs are intact, her 6 cardinal fields of gaze are intact, which means also that her oculomotor and trochlear abducens nerves are clear. I'm gonna go ahead and check also, now that I'm here, for her vision, which is her optic nerve, cranial nerve number 2. Can you put up your glasses?
Okay.
And tell me, for the purpose of this test, I'm just gonna stand right here, but it's supposed to be 6 feet apart. So tell me if you can read this line.
LTFP.
And then cover it. Yeah, so that means her bilateral vision with glasses is 20/20 bilaterally. Please take off, not take it off, just cover one eye for me. So for the left eye, go ahead and tell me if you can read this line backwards.
HPFTL.
Very good. And then cover the other eye. Read it again.
LTFPH.
Very good. So that means her right eye has a 20/20 vision and her left eye has a 20/20 vision. Optic nerve is intact. So moving down to the ears, looking for symmetry and alignment. So it looks like her symmetry, it's just symmetrical. Alignment is good. There is no signs of swelling. I'm gonna palpate for your auricular and pretragus area. Is it tender?
No.
So no tenderness or swelling. Lesions noted to the pretragus or auricular area. Notice that she has both ears are pierced. I'm gonna go ahead and inspect for any drainage. Doesn't look like she had any drainage to her ears bilaterally. Performing your otoscopic exam, I'm gonna go ahead and take a look inside your ear, if that's okay.
Sure.
All right, very good. I'm gonna go ahead and pull on your ear. Taking a look inside on the right, and then taking a look inside the left ear. So it looks like both right and left ear are clear. No cerumen is noted, no redness, no lesions are noted at this time. The sternal ear canal is clear, no drainage is noted. She does have a conal light present to the right is at 5 o'clock and a conal light present to the left at 7 o'clock. Her tympanic membrane is pearly gray, so no signs of infections are noted at this time. Moving down to assess for your hearing. So we're gonna do 3 tests, the Weber, the Rhine, and the whisper test, okay? So I'm gonna go ahead and use this here as a tuning fork. I'm gonna go ahead and hit it right here. And tell me when you can, if you can hear the sound the same on both sides.
Yes.
Okay, very good. I'm gonna do the same, and I'm gonna have you tell me when you stop hearing the sound.
No. No.
Going on the other side, I'm gonna do the same. Can you please tell me when you stop hearing the sound?
No. No.
All right, and now cover one ear for me, the other side, and tell me what you hear.
Apple.
Okay. Other side, can you cover it for me? Tell me what you hear.
99.
Very good. So for this test, the Weber, the Rhine, and the whisper test show that she doesn't have any sort of conductive hear loss, meaning that her vestibulocochlear cranial nerve is intact. Going down to the nose, can you please take off your glasses again for me? I'm gonna palpate the nose, check for symmetry. Nose is midline. Any tenderness on your nose? No tenderness. Can you cover one nostril for me and take a deep breath? And then let's do the other one. So it looks like her nose has no swelling, and each nostril is patent, so she can breathe normally. I'm gonna go ahead and take a look inside your nose, okay?
Sure.
Looking inside her nose on the right nostril, left, right, and then left. She has some clear drainage on the left side. The septum is midline, turbinates look patent, no swelling, no nodules are noted or through the exam. No polyps are noted, and turbinates are symmetrical. I'm gonna go ahead and inspect her mucosa inside the lining of her nose is also pink and moist. And I'm gonna go ahead and assess for your sense of smell, okay?
Okay.
So that will be the olfactory nerve, and I'm gonna go ahead and have you close your eyes. Can you cover your left side? And I'll have you smell this. Can you tell me what that is?
Peppermint.
Go ahead and cover the other side. What is?
Peppermint.
Okay, so it looks like her olfactory nerve is intact. So moving down to the mouth and pharynx, looking at her lips, they look like they're pink and moist. They're intact, no lesions are noted to her lips, no cracks or ulcers, or I'm gonna go ahead and have you open your mouth and stick your tongue out. And then, so the tongue is midline, no, and pink and moist. Vocal mucosa is pink and moist. No signs of lesions inside the mouth either. Soft palates and hard palates are also soft and pink. So we're gonna inspect for your teeth and your gums, and so if you can go ahead and give me a big smile. Very good, and show me your gums. I'm gonna go ahead and pull down, is that okay? Okay, so upon inspection, it looks like her teeth are aligned and no discoloration is noted. The gums are pink and moist. No swelling is noted as well. No drainage or foul odor to her mouth is noted. Let me take a look at your tonsils, okay? So open your mouth. Do you, yeah, 1 second. Let me take a look at your tonsils. Open your mouth. Say stick your tongue. Oh, have you had a surgery?
I had a tonsillectomy.
Gotcha. Okay. So no tonsils are noted at this time. And no white patches are noted to the back of the throat either. I'm gonna go ahead and inspect for the and checking for your gut reflex. When I checked her gut reflex, it was intact. So I'm gonna go ahead and inspect for your temporomandibular joint movement, okay? So
Okay.
can you tell me if you feel any tenderness? Okay, so open your mouth real big and then move it up and down. Okay, so no tenderness is noted, no clicking is noted to the TMJ's area. If patient has full range of motion as well. And we're gonna go ahead and test for the gut. I already did the gut reflex, so I'm gonna go ahead and test for swallowing and phonation. So I'm gonna have you swallow this right here.
Okay.
And tell me if you have any issues with that.
Okay. No.
No issues, so no signs of aspirations are noted. And then say real loud. So after the gut reflex and swallow test and gut phonation test, it looks like her glossopharyngeal and vagus nerves are intact. So we're gonna go ahead and assess for the movement of the tongue. Can you move your tongue up and down? And then side to side? Very good. And then can you say the word mama?
Mama.
Tip top.
Tip top.
Baseball player.
Baseball player.
So after this, we can tell that her speech is clear and her tongue is midline, and so the hypoglossal nerve is intact. Moving down to the neck, we're gonna assess and look at the neck area. It looks like it's clear. No masses are noted. Her skin is pink, warm, and dry. No rashes are noted. Her neck is symmetrical and midline. And before I do that, I'm gonna inspect your trachea as well, okay? Any tenderness over here?
No.
So trachea is midline, no tenderness or swelling noted to that area. By inspection, I can tell that there is no JVD distension to this area, so no JVD is noted. I'm gonna go ahead and assess for your range of motion of the neck, okay? So can you move or put your chin to your chest and then back a little more, and then touch your ears to your shoulders and touch your chin to your shoulders as well. Okay, so if patient has full range of motion of the neck, I'm gonna go ahead and have you push against my hip. Very good. And on the other side. So resistance or strength, to the neck is 5 out of 5. Now we're gonna go ahead and inspect for the thyroid. For the thyroid, have to go on your back, okay?
Okay.
So I'm gonna go ahead and touch you and assess for the thyroid area. Thyroid is not palpable at this time. No goiter or masses are noted. Moving down to the lymph nodes. So I'm gonna go ahead and assess, and you tell me if it's tender, okay?
Okay.
So we're gonna do the pre and post auricular nodes, your occipital nodes, any tenderness?
No.
Tonsillary nodes, tenderness, submaxillary, submental, superficial cervical nodes, and posterior deep nodes, posterior cervical, and then supraclavicular nodes. Any tenderness?
No.
So no tenderness upon palpation of the nodes, and no nodules were palpated. Moving down to checking for the accessory nerve. I'm gonna go ahead and have you push against resistance. Okay, so shrug your shoulders. Very good. So accessory nerve is intact. The strength of the shoulders is 5 out of 5. I'm gonna go ahead and auscultate for your carotid arteries, and I'm also gonna feel for them. So
Okay.
go ahead. I'm just gonna look straight and check for that. So pulses to the carotid arteries are 2+ bilaterally, no bounding pulses. I'm gonna go ahead and take a listen to them, okay?
Okay.
Listening with the bell of the stethoscope. No bruits or trills are auscultated to the carotids pulses bilaterally. So we're gonna go ahead and move down to the posterior thorax. So I'm gonna go ahead and look at your back. If you can take a seat over there.
Okay.
For the purpose of this assignment, the patient is gonna stay dressed, but it will be a better assessment if the patient didn't have any clothes on. I'm gonna go ahead and inspect the skin. It looks like the skin is pink and clear. No masses are noted. No rashes or retractions are noted. No heaves. Respiratory rate is non-labor and is even equally. The AP diameter is a 1:2 ratio. No accessory muscles are used. No dyspnea is noted. I'm gonna go ahead and inspect and palpate for deformities of your spine. So tell me if you have any tenderness.
No.
Okay, no tenderness or curvature noted to the spine, so the spine is clear. I'm gonna go ahead and assess for tactile firmness, and for that I'm gonna have you say 99 when I touch your back. 99.
99. 99. 99. 99.
All right, so the sound is clear with vibration and no dullness is noted. I'm gonna go ahead and have you say test for eugophony, and for that I'm gonna have you say E, taking a listen to 8 sites in her lung fields. So say E.
E. E. E. E. E. E. E. E.
Very good. So there is no evidence of consolidation. She has high pitch echoing to all the lung fields, the 8 sites that we auscultated. Now we're gonna go ahead and auscultate for breath sounds in the posterior thorax. Once again, auscultating in 8 sites. Take a deep breath in and out. Going in a lateral and downward motion. Once again. Auscultating with the bell of the, the diaphragm of the stethoscope. All the sounds are vesicular and clear throughout. Low pitch to the sounds is noted, which is a normal finding. I'm gonna go ahead and percuss your back, okay? So you're gonna feel me touch you. Percussing for 8 sites as well. And all the percussion is resonance is percussed throughout to all 8 sides. Assessing for CVA tenderness, we're gonna go ahead and touch your lower back. Tell me if you have any tenderness, okay?
No.
No?
No.
So no CVA tenderness is noted at this time. So I'm gonna have you move back forward and then look at the wall again. Once again, inspecting for the skin. It would be best if she didn't have any scrubs on, but for the purpose of this test, this is how we're gonna do it. So the skin looks pink, warm, and dry. No accessory muscles are being used at this time. No dyspnea. Her respiratory rate is even and unlabored. Trigger of the skin is good. No lesions or masses are noted. No pulsations or heaves are noted. So we're gonna go ahead and auscultate the same that we did with your back, okay?
Okay.
And we're gonna go ahead and auscultate for 4 sites, okay?
Okay.
Take a deep breath. Very good. Again. Again. And again. So bronchial sounds are auscultated throughout. They're high in pitch on the upper area. When we come to the lower area, we have some bronchovesicular sounds, which are a little lower in pitch. They're also clear and intermediate pitch. So moving on to your cardiovascular assessment, Timis, I'm gonna have you listening for your heart sounds, okay, in different positions.
Okay.
So let's go ahead and start with your aortic valve, which is on the right, second intercostal space on the right sternal border. We're gonna listen for 60 seconds on the bell, with the bell, and then 60 seconds with the diaphragm. Moving down to the second intercostal space where the pulmonic area is on the left side to the left sternal border, listening with the valve and diaphragm. For the purpose of this exam, I'm gonna go a little faster than 60 seconds, listening with the diaphragm to the Erb's point, which is third intercostal space on the left sternal border with valve and diaphragm. Moving down to the tricuspid area, listening with both valve and diaphragm, which is fourth and fifth intercostal space on the left sternal border, and last but not least, the fifth intercostal space, apex of the heart, which is mid-clavicular line, listening with diaphragm and the valve, after auscultation, we can say that Timis has S1 and S2 sounds presence, normal heart rate and rhythm, no S1 or no S3 or S4 gallops noted, as well as no murmurs are noted. Now we're gonna go ahead and have you lay flat, okay? So I'm gonna lay down the bed. Perfect. I'm gonna listen for the same points, pulmonic area on the second intercostal space on the right sternal border, listening with the bell and the diaphragm for 60 seconds. Moving down to the second intercostal space on the left side, left sternal border for the pulmonic area. Erb's point, third intercostal space, left sternal border, listening with the diaphragm. Tricuspid area, fourth and fifth intercostal space, listening with both bell and diaphragm. And down to the fifth intercostal space, mid-clavicular line for the mitral area. While Timis is laying down on auscultation, as Timis has S1 and S2 present, normal heart rate and rhythm, and no S3 or S4 sounds are present, as well as no murmurs. We're gonna have you lay on your left side, please. Listening for the same sides again on the second aortic area on the second intercostal space, right sternal border. Again, listening with valve and diaphragm, going on the second intercostal space on the left sternal border for the pulmonic area. Moving down to Erb's point right here, so third intercostal space, left sternal border. And then moving to the tricuspid area, which is the fifth intercostal space on the left sternal border, and finally going on the mid-clavicular line, doing on the fifth intercostal space, apex of the heart. Okay, perfect. So Timis, while you're laying down, I'm gonna go ahead and palpate for the point of maximum impulse, which is on the mid-clavicular line on the fifth intercostal space. And the findings on the PMI is that no pulsations are noted, which is a normal finding. So I'm gonna go ahead and have you lay flat again. And I'm gonna go ahead and palpate for the same sites, okay? I'm looking for trills or hips. Second intercostal space, aortic valve area on the right sternal border. Second intercostal space, looking for the pulmonic area on the left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid area, fourth and fifth intercostal space, left sternal border. And mitral area, fifth intercostal space, mid-clavicular line. In this case, her findings, the trills, there is no trills or hips, which is a normal assessment. We're gonna go ahead and palpate for your pulses, okay, Timmy? So I'm gonna go ahead and grab your hands here and check for your pulses. There are 2 plus and equal bilaterally, no bounding is palpated. I'm gonna go ahead and down to your femoral area, is that okay?
Yes.
And then I'm gonna feel for your femoral pulses, which are 2 plus and equal bilaterally, no bounding. Then checking for your dorsalis pedis pulses, which are also 2 plus and equal bilaterally, no bounding is felt. And then posttibialis, which are present, 2 plus and equal bilaterally, no bounding is felt or palpated. I'm gonna go ahead and inspect for your skin of the abdomen. In this case, I'm gonna have Timis just take over. So on inspection, just by looking at it, I can tell the abdomen is flat. There is no masses, no hernias. There's symmetry to the abdomen. No scarring is noted. I'm gonna go ahead and auscultate for your vowel sounds, Timmy's. For the purpose of this exam, I'm gonna go faster, but it's supposed to be 60 seconds on each quadrant. So I'm gonna go ahead and start with the right lower quadrant, listening for 60 seconds with the diaphragm. Left upper quadrant, sorry, right upper quadrant, left upper quadrant, and left lower quadrant. Vowel sounds are normoactive to all 4 quadrants. We're gonna go ahead and auscultate now that we're here for your arteries, and that's gonna be done with the bell of the stethoscope. So auscultating for any bruise. So we're gonna go ahead and auscultate for the aortic artery. Moving down to the renal arteries, iliac arteries, and femoral arteries. In this case, no bruits are auscultated, which is a normal finding. We're going to go ahead and start with percussing all 4 quadrants, starting with the right lower quadrant. Tell me if you feel any tenderness.
No. No. No.
On percussion of her abdomen, all 4 quadrants are, or 3 quadrants are tympanic, the right lower quadrant, left upper quadrant, and left lower quadrant. The right upper quadrant has dual sounds as the liver is located in this area, so this finding is normal. Now I'm going to go ahead and percuss for your liver span. So looking for just that dull sound. Once you hit that point, you know that you're in the liver area, starting from the bottom and then up from the third or fifth intercostal space until you hit that liver area. Moving down to the middle, starting the same way, looking for that dull sound, going from the umbilicus and up. So in this case, in the dullness area is about 7 centimeters, and so that's the span of her liver, which is a normal finding. Now I'm gonna go ahead and palpate for your abdomen. Okay, so tell me if you feel any pain.
No. 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 No.
So abdomen feels symmetric, no masses are palpated, is soft, and we're gonna go ahead and look now for the spleen. So I'm gonna go on this side over here. Take a deep breath, Denise. Very good. So their spleen, her spleen is not palpable, which is a normal finding. So no signs of alarmage are noted. Now I'm gonna palpate for a few signs, looking for certain things. So I'm gonna start off with the McBurney sign, which is in the right lower quadrant. Tell me if you feel pain, either when I push or when I let go. Okay.
Okay.
Any pain?
No.
Very good. So that means the McBurney point is negative. Usually that tends to be positive if a patient has appendicitis. Now going up right here to the, we're gonna move on to check for the rubbing sign, which is on the other side, which is the left lower quadrant. Any pain?
No.
Any pain when I let go?
No.
So no rebound tenderness is found. No rebound tenderness was found either with the McBurney's point. So rubbing sign is also negative. Looking for a psoas sign, which is also something that is used when we're trying to diagnose appendicitis. So I'm gonna go ahead and put pressure on your leg, okay? Lift your right leg for me and tell me if you have any pain when I push on it on the abdomen area. So lift your leg, very good. In that case, her psoas sign is negative. No pain is found. And last but not least, looking for the Morpheus sign, which is checking for her gallbladder, making sure she doesn't have any tenderness there. Timmy's, go ahead and take a deep breath, and I'm gonna push right there, okay? Deep. Any pain?
No.
So in this case, Timmy's Morpheus sign is also negative. And we're gonna go ahead and check for some for your inguinal lymph nodes, which is in the femoral area. So is that okay?
Yeah.
All right, I'm gonna go ahead and feel for it. And then over here. So in this case, our lymph nodes are not palpable bilaterally, which is a normal finding. So moving on with your neurological exam, Timmy's, I'm gonna have you do a few things. So if you could please stand for me.
Sure.
I'm gonna assess for the Romberg sign, which means I'm gonna have you stand and see how your balance is. And now I'm gonna have you close your eyes. Try and stay still. There is no loss of balance, and so basically the rumbar sign is negative. Moving down to your gait, I'm gonna have you walk down right here, assessing your gait. That is gait symmetrical and steady. No loss of balance while she does that. And now I'm gonna have you walk heel to toe. So one foot in front of the other. It looks like she has no loss of balance, and she can walk in a straight line. And then I'm now gonna have you just looking this way at the wall. Touch your finger with one hand and then the other, kind of going back and forward in this motion. So movement is smooth and rapid and accurate. Now I'm gonna have you grab my hands right here and squeeze my fingers and pull back, and then I'm gonna push you. All right, very good. So hand grip is equal bilaterally. Strength is 5 out of 5. I'm gonna go ahead and check for the rebound phenomenon. So for that, I'm gonna have you take a seat again, and I'm gonna have you close your eyes, and I'm gonna have you squeeze my hands and push on me, and then back. It's a good push right there. So the rebound phenomenon is negative. So then we're gonna move on for the check for sternosis and graphesthesia. So I'm gonna put some objects in your hand and then tell me if you can identify them, okay? Close your eyes. And what's in your hand?
Glasses?
Yes. And then I'm gonna give you something else. It can be heavy. Can you grab this?
Cup?
Yes. Perfect. So you can open your eyes again. Actually, we're gonna check for the graphesthesia. So I'm gonna draw something in your hand and you tell me what that is, okay?
Figure 8.
Perfect.
A straight line.
All right, very good. So for Denise, her diagnosis and her graphesthesia test is intact. Now I'm gonna go ahead and check for your speech. So if you can repeat these words after me. You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Very good. So Denise's speech is clear. I'm gonna go ahead and assess. I'm gonna actually have you lay back down.
Okay.
And can you actually touch all the way? Touch with your foot, the shin of the opposite foot, up and down, please. Like that. And the other side. So the movement is straight, no imbalances noted, no irregular deviation to the side. I'm gonna go ahead and assess now for your reflexes, Timmy. So for that, I'm gonna grab this right here. And can I actually have you take a look straight at me? Sorry about that. And I'm gonna check for your bicep reflex at a 45-degree angle, like that. Like that. Perfect. I'm gonna go ahead and assess for your tricep reflex. Kind of let go of your arm. All right, and then the other side. Kind of let go. All right, very good. Now I'm gonna assess for the brachioradial reflex right here. One more time. Very good. I'm gonna check for your patella reflex, okay? So just kind of let go of your legs. Very good. One more time. Very good. And last but not least, I'm gonna check your Achilles tendon. So I'm gonna hold your foot right here. And I'm gonna hit the back of your foot like so. And then right here. Very good. So for Denise's reflexes, they're all 2+ and equal bilaterally. We check the biceps, the triceps, the brachioradial reflex, patellar, and Achilles reflexes. 2 plus and equal bilaterally. We're gonna go ahead and inspect the upper and lower extremities. So it looks like Timis has a smooth skin, it's warm, pink, and dry. No swelling is noted to the lower extremities or the upper extremities. We're gonna go ahead and assess for range of motion for you. So let's go ahead and start with your shoulders, which we already did earlier, but we're gonna do a shoulder shrug. Go ahead. And that's a 5 out of 5 for resistance. And I'm gonna have you put your hands back and then lift your arms and then give yourself a hug one way, give yourself a hug the other way around. Perfect. So she has full range of motions to the shoulders. Moving down to the elbows, can you flex your elbows like so? And the other way, and then put your palms up the other way around. And I'm gonna have you I'm gonna pull and you kind of hold against resistance, okay? And then I'm gonna push. Perfect. So Timis has a full range of motion to the elbows bilaterally, and resistance is 5 out of 5, or strength is 5 out of 5. Then we're gonna move down to the wrist, and then I'm gonna have you kind of just move it like so, and then turn it back in, up and down, in and out. Perfect. So she has full range of motion of the wrist. I'm gonna push against her. I'm gonna push against you, and then give me some resistance this way. Perfect. So resistance is a 5 out of 5 for the, or strength is 5 out of 5 for the wrist. Moving down to the fingers, we tested that earlier, but can you move your fingers like so, and then your toes as well? Perfect. And she has good grip strength. She can pull back as well. We're gonna check for your hips. I'm gonna have you lay back down. Okay. And I'm gonna have you lift one leg, and then lift the other, and then push one leg out to this, and then in and under or over, and then the other side as well. We're gonna go out and over. Perfect. I'm gonna have you turn or flip over to your other side, and then I'm gonna have you lift this leg back. There we go. And then the other. Okay, you can turn back around. Perfect. And then I'm gonna have you sit again. So Timis has full range of motion for the hips. I'm gonna test for her strength. So go ahead and push against resistance, Timis. Perfect. And then back down. Perfect. So her hips are 5 out of 5 for strength. Moving down to the knees, Timis, I'm gonna have you extend your legs for me. Extend them and then flex them. And then I'm gonna have you push against resistance, and then the other way around. So Timis has a full range of motion to the knees, as well as a 5 out of 5 for strength. Moving down to the ankles, I'm gonna have you back lay down, and then I'm gonna go ahead and have you pull your ankles outwards that way, like so, and then inside. Perfect. And then open down. Perfect. And then I'm gonna have you push on the gas pedal, and then push on my hands. Perfect. So Timis has a full range of motion of the ankles and has 5 out of 5 for strength on the ankles. While you're laying down, I'm gonna go ahead and check for the Babinski reflex. So just kind of relax, and then I'm gonna go ahead and check. Very good. Very good. So Babinski reflex is negative, which is a normal findings for adults. Moving down to your capillary refill, I'm gonna check for your toes. It looks like she has some nail varnish on. Capillary refill to the toes is less than 3 seconds. And then I'm gonna look at your fingernails. Very good. Capillary refill to the nails or the fingers is brisk, less than 3 seconds. That means I'm gonna palpate for your joints, make sure you don't have any tenderness, okay? If you do, let me know. Okay, so checking on the joints in the elbow, any pain? Shoulders?
No.
No. Going down to the elbows, any pain?
No.
Okay, pretty good. Looking at the hips, any pain?
No.
Okay, very good. Wrists, any pain? Move it up and down? No?
No.
Very good. Knees?
No.
And ankles? Any pain to your ankles?
No.
Perfect. So looking at Timis's joints, head to toe, there is no tenderness to any of them. I'm gonna have you actually stand again. I'm gonna check for the range of motion of your spine. And then go ahead and go back a little, and so extend your back like so. Perfect. And then try and touch your toes. Very good. I'm gonna feel for the curvature of your spine. Timis has no curvature or abnormal curvature, so no lordosis or scoliosis noted to Timis's spine. Go ahead and stay straight. Checking for any abnormalities. Everything looks midline, no tenderness, upon palpation. Her spine has full range of motion and strength as well. I'm gonna go ahead and check for your knees again. I'm gonna do a few tests, Timis, over here. Okay, perfect. And now that we're laying down again, while I was doing my assessment, abdominal assessment, I forgot to do the obturator sign. So what I'm gonna have you do is lift the right leg for me, and then put your foot inwards. Is there any pain in your belly?
No.
So that means that the obturator sign is negative. So now moving down, like I said, to the knees. We're gonna go ahead and palpate for any swelling to the patella. No swelling is noted to the patella area. No deformities are noted. We're gonna start off with the varus valgus test. So I'm gonna have you bend your knee just a little, about a 45-degree angle, and I'm gonna push on your knee in the opposite ways, and then tell me if that hurts. Any pain?
No.
Perfect. So we're gonna go on the other side. Can you bend your other knee? I'm gonna push on that. Any pain?
No.
Perfect. So for her valgus and varus test is negative. There is no pain or no tenderness. Now we're gonna do something called the drawer test, which I'm gonna have you bend your foot like that at about a 45, and then I'm gonna put some pressure right here, and I'm gonna pull on your knee or lower portion, and then tell me if you have any pain, okay?
No.
Any pain? No? Perfect. And then I'm gonna go ahead and do the same on this side. While sitting on your foot, I'm gonna pull. Pain?
No.
Okay, very good. So her drawer sign is negative. Now I'm gonna check for the Lachman test, which is, I'm gonna have you bend your knee at 45 degrees. Excuse me, and then we're gonna put your foot a little closer to your bottom. Very good. And I'm gonna pull on it from this lower area, and you tell me if that hurts, okay?
No.
No? Okay. And the other side? No. Any pain?
No.
Okay. So the Lachman test is negative. Timis, this concludes my head-to-toe assessment on you. Thank you for allowing me this opportunity.
Thank you.
And we'll see you in a later time.
Okay, thank you.
Thank you so much.